CEN Test Prep free. Question 1. A patient is brought in with a diagnosis of schizophrenia who is actively hallucinating. What is the best nursing approach? Option A. Tell the patient the voices are not real. Option B. Ask the patient what the voices are saying. Option C. Ignore the patient's hallucinations. Option D. Place the patient in restraints. The correct answer is option B. Ask the patient what the voices are saying. It is appropriate to ask the patient about the content of hallucinations in a non-judgmental manner. This helps assess for command hallucinations that may be dangerous. Telling the patient the voices are not real, A, denies their experience. Ignoring, C, is dismissive. Restraints, D, are unnecessary unless the patient is a danger. Question 2. A patient at 34 weeks gestation presents with vaginal bleeding and abdominal pain. What is the priority nursing action? Option A. Assess fetal heart rate. Option B. Obtain maternal vital signs. Option C. Prepare for emergency delivery. Option D. Perform a pelvic examination. The correct answer is option B. Obtain maternal vital signs. The ABCs and maternal stabilization are the priority. Vaginal bleeding in the third trimester may be from placental abruption or placenta previa. Maternal vital signs indicate hemodynamic stability. Fetal heart rate, A, is important but secondary to maternal status. Pelvic exam, D, is contraindicated until placenta previa is ruled out. Question 3. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A. Wernicke-Korsakoff syndrome. Option B. Delirium tremens. Option C. Alcoholic ketoacidosis. Option D. Hepatic encephalopathy. The correct answer is option A. Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. Delirium tremens, B, presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C, presents with metabolic acidosis. Hepatic encephalopathy, D, presents with altered mental status due to liver failure. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which finding in a patient with pneumonia would indicate the need for ICU admission? Option A. Respiratory rate of 24 breaths/min. Option B. Altered mental status. Option C. Temperature of 101.5 degrees Fahrenheit. Option D. WBC count of 15,000. The correct answer is option B. Altered mental status. Altered mental status in a patient with pneumonia indicates severe illness, possible sepsis, or hypoxemia, and warrants ICU-level care. A respiratory rate of 24, A, is mildly elevated and can be managed on a medical floor. Temperature of 101.5 degrees Fahrenheit, C, is common with pneumonia. WBC of 15,000, D, is elevated but not indicative of ICU need by itself. Question 5. A patient presents with nuchal rigidity, photophobia, and altered mental status. What is the priority diagnostic test? Option A. CT scan of the head. Option B. Lumbar puncture. Option C. MRI of the brain. Option D. Blood cultures. The correct answer is option A. CT scan of the head. While lumbar puncture, B, is diagnostic for meningitis, a CT scan of the head must be performed first to rule out increased intracranial pressure, which would make lumbar puncture dangerous. Blood cultures, D, should be obtained but after CT, MRI, C, is not the initial test. Question 6. A patient presents with sudden onset of sharp chest pain and dyspnea following a long flight. What is the most likely diagnosis? Option A. Spontaneous pneumothorax. Option B. Pulmonary embolism. Option C. Acute coronary syndrome. Option D. Pericarditis. The correct answer is option B. Pulmonary embolism. This patient has risk factors, prolonged immobility from a long flight, and classic symptoms of pulmonary embolism, sudden dyspnea and pleuritic chest pain. While spontaneous pneumothorax, A, can cause similar symptoms, the history of prolonged travel makes PE more likely. ACS, C, presents with chest pressure with radiation. Pericarditis, D, pain is positional. Question 7. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO 324 milliequivalent/L. What is the most likely interpretation? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option C, respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO2. Question 8. A patient with a known history of type 1 diabetes presents with nausea, vomiting, and a blood glucose of 450 mg/dl. ABG shows pH 7.15, HCO3 12 milliequivalent/L. What is the priority intervention? Option A, administer regular insulin 4. Option B, administer 4 fluids. Option C, administer potassium. Option D, obtain a urine ketone test. The correct answer is option B, administer 4 fluids. In DKA, fluid resuscitation is the first priority to correct dehydration and improve perfusion. Insulin, A, is given after fluids. Potassium, C, is given after the patient is rehydrated and potassium is monitored. Urine ketones, D, are important but not the priority. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with heart failure presents with acute pulmonary edema. The nurse anticipates which initial medication? Option A, for furosemide. Option B, for morphine sulfate. Option C, for nitroglycerin. Option D, for dobutamine. The correct answer is option C, for nitroglycerin. For acute pulmonary edema, for nitroglycerin is often the first line medication as it causes venous and arterial vasodilation, reducing preload and afterload, and quickly relieving symptoms. Furosemide, A, is used for diuresis but takes longer to work. Morphine, B, is used cautiously and is not typically first line. Dobutamine, D, is for cardiogenic shock with low cardiac output. Question 10. A patient with suspected stroke has a blood pressure of 190/110 mmHg. What is the appropriate nursing action? Option A, administer 4 labetalol to lower blood pressure. Option B, administer 4 hydralazine. Option C, allow blood pressure to remain elevated unless there are signs of end-organ damage. Option D, administer a nitroprusside drip. The correct answer is option C, allow blood pressure to remain elevated unless there are signs of end-organ damage. In ischemic stroke, elevated blood pressure is often compensatory to maintain cerebral perfusion to penumbral tissue. Current guidelines recommend against lowering blood pressure unless it is extremely high, greater than or equal to 220/120, or the patient is receiving thrombolytics. This patient does not qualify for intervention yet. Options A, B, and D are not recommended unless criteria are met. Question 11. A patient with COPD is receiving supplemental oxygen. The nurse is most concerned if the patient's oxygen saturation is maintained at which level? Option A, 88-92%. Option B, 93-95%. Option C, 96-100%. Option D, 85-88%. The correct answer is option C, 96-100%. In COPD patients, The goal is to maintain oxygen saturation between 88–92%. Excessive oxygen can suppress the hypoxic drive and lead to hypercapnic respiratory failure. A saturation of 96–100% is too high and may worsen ventilation in these patients. Saturation below 88% D is too low. Question 12. A patient presents with acute pelvic pain, fever, and cervical motion tenderness, chandelier sign. What is the most likely diagnosis? Option A, ectopic pregnancy. Option B, ovarian torsion. Option C, pelvic inflammatory disease. Option D, appendicitis. The correct answer is option C, pelvic inflammatory disease. The classic triad of PID is pelvic pain, fever, and cervical motion tenderness, chandelier sign on bimanual exam. Ectopic pregnancy, A, would present with pain and bleeding but often no fever. Ovarian torsion, B, presents with sudden, severe unilateral pain without cervical tenderness. Appendicitis, D, presents with right lower quadrant pain. Question 13. A patient with a dog bite to the hand presents 48 hours later with redness, swelling, and purulent discharge. What is the most likely causative organism? Option A, Staphylococcus aureus. Option B, Pasteurella multocida. Option C, Streptococcus pyogenes. Option D, Bichnella corrodens. The correct answer is option B, Pasteurella multocida. Pasteurella multocida is the most common organism isolated from dog and cat bite wounds. It typically causes infection that appears within 24–48 hours with purulent drainage. Staphylococcus aureus, A, and Streptococcus pyogenes, C, are also common but less specific to animal bites. Bichnella corrodens, D, is associated with human bites. Question 14. A patient is brought in with a nail gun injury to the chest. What is the priority nursing action? Option A, remove the nail. Option B, apply pressure to the wound. Option C, obtain a chest X-ray. Option D, assess for pneumothorax. The correct answer is option D, assess for pneumothorax. A nail gun injury to the chest can cause pneumothorax, hemothorax, or cardiac injury. The priority is to assess the airway and breathing. The nail should not be removed, A, as it may be tamponading a bleeding vessel. Pressure, B, may be applied but the priority is assessment. Chest X-ray, C, will help determine injury but follows assessment. Question 15. A patient with a diagnosis of bipolar disorder is brought in for mania. Which of the following is a priority nursing intervention? Option A, administer lithium immediately. Option B, ensure the patient is in a safe, calm environment. Option C, restrict fluid intake to prevent water intoxication. Option D, place the patient in seclusion. The correct answer is option B, ensure the patient is in a safe, calm environment. Safety is the priority. A calm, safe environment with decreased stimulation can help manage manic behavior. Lithium, A, may be prescribed but administration is a provider order. Fluid intake, C, should be monitored but lithium requires adequate fluid intake. Seclusion, D, is only for imminent danger. Question 16. A patient who has ingested a large amount of acetaminophen is at risk for? Option A, acute kidney injury. Option B, hepatic necrosis. Option C, pulmonary fibrosis. Option D, cardiomyopathy. The correct answer is option B, hepatic necrosis. Acetaminophen toxicity causes hepatic necrosis due to accumulation of the toxic metabolite NAPCI, which depletes glutathione and damages hepatocytes. Acute kidney injury, A, can also occur but is secondary. Pulmonary fibrosis, C, and cardiomyopathy, D, are not associated with acetaminophen toxicity. Question 17. A patient with severe asthma exacerbation has a peak expiratory flow rate, PEFR, of 35% of personal best. Which treatment should the nurse anticipate? Option A, continuous nebulized albuterol. Option B, oral corticosteroids. Option C, 4-magnesium sulfate. Option D, immediate intubation. The correct answer is option A, continuous nebulized albuterol. PEFR below 50% indicates a severe exacerbation requiring aggressive bronchodilation. Continuous nebulized albuterol is indicated for severe asthma. Oral corticosteroids, B, should also be given but are not the immediate treatment. For magnesium, C, may be used for refractory cases. Intubation, D, is for impending respiratory failure with altered mental status, exhaustion, or hypercapnia. Question 18. In a patient with suspected acute coronary syndrome, which of the following is the priority nursing action upon arrival? Option A, obtain 12-lead ECG within 10 minutes. Option B, start 2 large -bore 4 lines. Option C, administer chewable aspirin. Option D, draw cardiac enzymes. The correct answer is option A. Obtain 12-lead ECG within 10 minutes. The priority for suspected acute coronary syndrome is a 12-lead ECG obtained within 10 minutes of arrival. Rapid identification of STEMI allows for timely reperfusion therapy. While aspirin, C, should be given promptly, the ECG is the priority for diagnosis. For access, B, and lab draw, D, are important but follow the ECG. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with anorexia nervosa presents with significant electrolyte abnormalities. Which electrolyte finding is most concerning? Option A, hypokalemia. Option B, hyponatremia. Option C, hyperkalemia. Option D, hypercalcemia. The correct answer is option A, hypokalemia. Hypokalemia is the most common and concerning electrolyte abnormality in anorexia nervosa, particularly related to purging behaviors. It can lead to cardiac arrhythmias, weakness, and QT prolongation. Hyponatremia, B, can occur but is less common. Hyperkalemia, C, is not typical of anorexia. Hypercalcemia, D, is not associated. Question 20. A patient has presented to the ED with a complaint of chest pain. Which of the following represents an appropriate delegation of tasks to a nursing assistant? Option A, perform a 12-lead ECG. Option B, obtain vital signs. Option C, administer aspirin. Option D, assess the chest pain. The correct answer is option B, obtain vital signs. Obtaining vital signs is within the scope of practice for a nursing assistant and is appropriate for delegation. Performing an ECG, A, may be delegated in some states but is often a nursing responsibility. Administering aspirin, C, is a medication and cannot be delegated to a nursing assistant. Assessment, D, cannot be delegated. Question 21. A patient presents with a swollen, painful ankle following a fall. The nurse notes that the patient is unable to bear weight. Which test should be performed to guide the need for X-raise? Option A, Ottawa ankle rules. Option B, pivot shift test. Option C, Lockman test. Option D, McMurray's test. The correct answer is option A, Ottawa ankle rules. The Ottawa ankle rules are clinical decision rules to determine whether X-rays are needed for ankle injuries. Inability to bear weight is one criterion that indicates the need for X-rays. Pivot shift, B, and Lockman, C, test the knee for ACL injury. McMurray's test, D, tests for meniscal injury. Question 22. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A, sudden, severe thunderclap headache. Option B, gradual onset of confusion. Option C, focal weakness on one side. Option D, loss of consciousness without headache. The correct answer is option A, sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Question 23. A patient presents with severe right upper quadrant pain radiating to the right shoulder, nausea, and vomiting. The nurse anticipates a diagnosis of Option A, acute pancreatitis. Option B, acute cholecystitis. Option C, peptic ulcer disease. Option D, gastritis. The correct answer is option B, acute cholecystitis. The classic presentation of acute cholecystitis is severe right upper quadrant pain radiating to the right shoulder or back, Care's sign, along with nausea and vomiting. Acute pancreatitis, A, pain is epigastric and radiates to the back. Peptic ulcer disease, C, is epigastric pain. Gastritis, D, is epigastric burning or pain. Question 24. A patient with diabetes presents with a blood glucose of 550 mg/dl, serum osmolality of 320 mosm/kg, and a serum pH of 7.35. What is the most likely diagnosis? Option A, diabetic ketoacidosis, DKA. Option B, hyperosmolar hyperglycemic state, HHS. Option C, hypoglycemia. Option D, lactic acidosis. The correct answer is option B, hyperosmolar hyperglycemic state, HHS. HHS is characterized by severe hyperglycemia, greater than 600 mg/dl, elevated serum osmolality, greater than 320 mosm/kg, and absence of significant ketosis or acidosis, pH greater than 7.3. DKA, A, presents with acidosis, pH 7.3, and ketones. Hypoglycemia, C, presents with low blood glucose. Lactic acidosis, D, has normal glucose. Question 25. In triaging a patient with abdominal pain and a fever of 102 degrees Fahrenheit, the nurse should assign which triage category based on the Emergency Severity Index, ESI. Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. ESI 2 is for high-risk patients who are not in immediate danger but require rapid assessment and treatment. A patient with fever, 102 degrees Fahrenheit, and abdominal pain meets criteria for ESI 2, high-risk. ESI 1, A, is for life-threatening conditions requiring immediate intervention. ESI 3, C, is for stable patients requiring 1-2 resources. ESI 4, D, is for stable patients requiring no resources.